setting is home visit.
You are visiting an 87-year-old man whose partner passed away 10 years ago from a heart attack. He has no other family support. You have been asked to visit the patient as the doctor is concerned about the ulcer on his ankle, which has become infected. The doctor is also worried about the patient's compliance with the antibiotics and general health.
Let's have a look at the task. Explain why the doctor has asked you to visit and what you will do at each visit. Clean the wound, apply cream, and rebandage it. Give advice on how the patient can manage the wound at home. Keep the bandage dry, elevate ankle, and rest. Ask about patient's antibiotic compliance. Explain the importance of taking antibiotics regularly and completing the course. Ask the patient about his diet. Suggest respite care for 8 weeks in an aged care facility until wound is healed. Monitor medication and dressings, provide meals and support during his recovery.
Here is a tip in this role play. You can ask questions first, and at the last task, you can provide your suggestions.
Let's start the role play.
Good morning, my name is Vinitha, one of the community nurses working in this locality.
Good morning, nurse.
Am I speaking to Mr. Joshi?
Yes, nurse, you are.
Purpose of my visit is to check your ulcer on the right ankle, which has become infected on daily basis.
Well, please come in and have a seat.
Thanks, Joshi.
Thank you, nurse, for your concerns. But I do not think I need someone to visit me on daily basis.
Mr. Joshi, like I informed you earlier, your doctor is really concerned about your infected ankle. Along with that, he is anxious about your compliance with antibiotics and your general well-being.
I understand that, nurse. Can you explain me what you're going to do on each visit in detail?
Definitely, Mr. Joshi. I will inspect your wound on day-to-day basis, followed by cleaning the infected ankle area, and will apply necessary cream for healing, and finally will rebandage it. Is that clear to you?
Yes, nurse. Nurse, can I ask you a question about my dressing?
Sure, please.
My dressing is getting dirty always. I am unsure how to look after it.
No worries, I can help with that. With your present situation, it is very important to take adequate rest. Apart from this, please keep your bandage dry always. For example, whenever you take shower, try to cover the dressing to prevent getting wet. And lastly, ankle elevation. Try to keep your ankle elevated while you are in sitting position, especially when watching television for a prolonged period. Will you be able to do these measures?
Sure, nurse. I will try to follow.
Before I proceed any further, first, I'll ask you some questions to give me a better understanding of your situation. Then, I will explain the changes that you've to make in order to manage your condition. Following that, you can ask me any questions that you may have. How do you feel about what I am proposing?
Sounds fine for me.
Can you please tell me about your medication compliance? To be precise, about your antibiotic course.
Nurse, sometimes I forget to take the antibiotics in the mornings, so I take double in the evenings. I am getting old. I'm 87 now. My partner passed away 10 years ago. And we have no children or other family support. So I can't follow all the instructions and timings as requested. Hope you can understand that, and please tell me, is this his problem if I miss timings and double dosing?
First of all, I am sorry for your loss. And it must be very difficult for you to handle things without any support. Yes, there is problems if we miss dose or taking double dose. It's because taking them regularly until the prescription is complete helps ensure that all of the illness-causing bacteria are killed or prevented from multiplying. When it comes to your case, your wound is already infected. Therefore, antibiotics play a vital role in healing. Would you mind me about your diet pattern?
I have not been eating well, as I am unable to move easily around the kitchen due to the ulcer on my ankle. And I am becoming more weak.
Oh, that's a difficult situation. Thank you for providing me the details, Mr. Joshi. Based on the information collected at this stage, you need support to take care of you. So, I am suggesting respite care for 8 weeks until your wound is healed. Is that okay with you?
Respite care. Can you explain me what it is exactly?
Sure, Mr. Joshi, I will. Respite care means short-term arrangement for care. It can be arranged for a day, or for several days, or weeks. In your case, since there is no one to support you at home, I recommend for 8 weeks, like I explained earlier, for complete recovery.
Thanks for the support, nurse, but I prefer my home, and I believe I will be able to cope at home.
I understand and respect your decision, and I know the final decision is yours, but can I explain you the benefits of a temporary care for you at this stage?
Benefits? What are they?
Firstly, they can monitor your medication compliance, especially your antibiotics. Secondly, wound inspection and daily dressing. Next, your dietary requirements. They will manage your food preferences and will provide them at the right timings. If you stay at home, like you explained, you are getting weak since you are unable to move around for cooking or eating. Lastly and most importantly, they will provide care and support for you throughout your recovery process, as there is no one at home to help you. How does that sound?
That is a good suggestion, nurse. And I am ready for respite care.
Thank you, Mr. Joshi. Being said that, do you have any more concerns?
No, nurse, you clarified all my doubts. And thank for all the support and information.
It was my pleasure. Well, it was great meeting you. I will arrange the respite care as early as possible and will update you.